Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. This baby late preterm, 36 weeks, delivered by spontaneous vaginal delivery, and the baby after delivery start to have retraction, grunting, tachypnea, and he require positive pressure ventilation, non-invasive ventilation, new buff CPAP, FI2 oxygen requirement is 30% initially, but unfortunately the baby is not maintained his saturation, so immediately intubated and connected to mechanical ventilation and receive 1 dose of Servanta and X-ray requested. The assessment at that time, this baby is or the professional diagnosis, this late preterm 36 weeks RDS to rule out early onset neonatal sepsis. So this is the X-ray. If you will see here, this is the classic picture for the RDS. You will see small lung volume, air bronchogram, and the haziness, ground glass appearance. This is the 3 feature for RDS: decreased lung volume or small lung volume, ground glass appearance, and air. You see here air bronchogram, here the air bronchogram and the ground glass appearance, diffuse haziness, and decreased lung volume, And if you see here, there is fissure here. There is transverse fissure. Can give you clue. Might be it's also one of the differentials will be TTN, transient tachypnea of the newborn. But most probably it will be RDS because the baby is premature and distressed and tachypnea. So, but if you will see here also the gas distribution in the bowel is within normal. If you see the stomach is big, looks like dilated, it might the differential to gastric outlet obstruction or due to resuscitation the new buff and he received a lot of air, so the stomach was dilated. But here the most important thing, if you see here, this is the OGT. If you see here, this is the OGT. Here, this is the OGT. The tip of the OGT in the middle of the esophagus. So this is malposition of the OGT. This is our finding here. The tip of the OGT in the middle of the esophagus. So malposition, and the normal position should be intended to reach to the stomach. Should be reached to the stomach in the bubble of the stomach, under the diaphragm. So the tip of the OGT in the middle of the esophagus. What is the complication leading to what? 3 issues. The first one actually can lead to inadequate feeding or drainage. The second, and the most important, it lead to aspiration, shocking attack, cyanosis, apnea, ABCs, if the feeding or medications are delivered into the esophagus, then refluxing in the airway. The third issue, potential esophageal injury, lead to esophageal injury, especially if the tube actually stay for a long time. If this tube stayed for a long time, can lead to esophageal injury. Type. What is the normal position? The normal position for OGT, the tip of the OGT should be below the diaphragm in the stomach, usually seen near to the left upper quadrant in the X-ray in the stomach bubble. This is should be the normal position for the OGT. What is the recommendation for such cases? What are going to do? What is your action plan? First, the tube should be advanced under clinical supervision, and you have to repeat the X-ray may be needed to confirm the position of the OGT. The second recommendation, don't use the tube for feeding or medication until proper gastric placement is confirmed. So our message from this case, for sure this baby is RDS, it will be 3 finding: ground glass appearance, air bronchogram, and also decreased lung volume. But our message from the case regarding the OGT position, if the OGT in the middle of the esophagus, what is the complication? Inadequate feeding or drainage. The second, risk of aspiration, choking attacks, and cyanosis if the feeding or medication are delivered in the esophagus and lead to refluxing in the airway, and if it stay for a long time can lead to esophageal injuries for prolonged time. The recommendation, you have to advance it and to be under clinical supervision and to repeat the X-ray and be sure about the OGT in the proper position. The second recommendation, don't use it, the tube, until proper position and confirmed by X-ray. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.